Also, in your book, you shared how many women who get off the pill will feel more themselves again, these sort of intangibles, reconnected with their intuition. You also shared, I loved your warning label. If there were a transparent hormonal birth control label, it's really eye opening. And you shared that studies that show as many as 51% of women experience mood disorders on hormonal contraceptives. Can and yet they may be told again that this is normal. Can you comment on how it seems the medical establishment may be downplaying these mental health risks?
Well, we already know that women are considered to be more emotional and we're all of the stereotypes, so I don't even need to go through them. But in other words, when you as a woman go to a doctor and say that you have anxiety or depression or panic attacks, there's this inherent issue with, well, that's just part of being a woman. So there's this inherent barrier, I would say, to proper diagnosis and care, just in general. And I think that we can all recognize those stereotypes. Is there a woman on earth who has not experienced at least once in her life that type of, you know what I mean? Like that type of discrimination, or I don't know if discrimination is the right word, but I think you know what I mean, kind of being put aside because of your emotions. Like even if you're premenstrual and you are upset about something, certainly many of us have had the experience where our partner saying, "Oh, you're just on your, moon time or whatever," even though you're legitimately upset about something. Okay, so that aside, it's definitely a challenge for women to who are on birth control to have that assessed, and there's a number of reasons why. I would say one of the reasons is because although there is a lot of evidence to show that there is a connection between hormonal birth control and mood changes, literally on, if you search whatever brand of hormonal contraceptive and you look in the insert and you read it, mood changes are there. Anxiety, depression sometimes are there. Sometimes it's under the label of mood changes, but it's there. So we know that it's there. Even the manufacturer has it listed as one of the potential side effects. And so that the warning label in the book, I didn't make that up. Like literally everything was either in a study or on the actual manufacturer's pamphlet, but I used layman's language, layman's words, so that it's very clear what it means. So with that said, what I learned when I interviewed a number of doctors over the years, on the podcast, is that in medical school, it seems as though doctors are taught about the life-threatening side effects and how to potentially mitigate those risks, almost to the exclusion of some of the non-threatening, non-life-threatening risks. So specifically, when I was interviewing doctors, what I was told by, the doctors were that they were taught about the risks of stroke and pulmonary embolism, etc. And they were taught that women over 35 or women who smoked or maybe women who are morbidly obese are at a greater risk. So they're looking for those types of contraindications so that they can refer. And even in cases like that, often they're actually referring, so they're identifying those factors to identify then which other type of hormone would be a lower risk. So it's not even to say that these women can't be on contraceptives. It's more like they can't be on these kind of contraception. Maybe we don't put them on an estrogen containing one, but we can put them on a different one. So when it comes to anxiety and depression and the libido and difficulty to orgasm and painful sex, many practitioners, many doctors don't seem to know or aren't necessarily familiar with those side effects. A scary stat to illustrate this is that teenage girls who are on hormonal contraceptives are much more likely to also be on antidepressants. And, if you and there's research and studies that show this correlation. And if you knew that hormonal contraceptives increase your chance of depression, anxiety, those types of things, then if a teenage girl, if a 16-year-old comes into your office and she says she's depressed, it would make logical sense to say, well, are you on contraceptives? We know there's a link there. And if she says yes, we could do something like, okay, well, since you're coming to me today because you're concerned about depression, and we know that it could be linked to the contraceptive, maybe we should come off of it for 3 months and see if your depression improves. And if it doesn't, then we can look at, some other prescription or some other type of treatment for that. That's not what happens. So for adult women then who are, facing these types of side effects and symptoms, the hard truth is that it's kind of up to you to educate yourself on some of those most common side effects, because it's not every time you go into your doctor's office that those links are going to be made. And you're maybe more likely to come out with another prescription for an antidepressant than you are for someone to make the link that it could be related to the birth control. And sorry, one more thing I want to say on that. Um, Many women who have these emotional problems regarding, because they're on hormonal contraceptives end up in psychologist's office or, they go to a psychologist, they go to a therapist. And often, again, the therapist doesn't necessarily screen to say, are you on contraceptives? Because we know there's a link. So again, you could be fully getting therapy for a condition of anxiety, panic attacks, depression, and you're right. Like you could fully be sitting there having this experience of therapy when literally you just need to switch contraceptives or come off contraceptives.